just the knowledge about your own microbes and the importance that diet can change things very drastically with your microbiome, I think that is a good starting point for anyone to know. So let's start with an interesting study that I came across. It was about, me and my passion for anything related to the microbiome. So I came across a study about probiotics. And generally, when we're looking at studies, it's connected to certain things, like gut health or, blood sugar, things like that. But this particular study was with muscle mass and the elderly. So it really caught my eye. Yeah. So I started looking into that.
Those are hot topics right now. Muscle mass, strength, aging gracefully. I mean, they've tried probiotics with some success, I think. Yeah. Depression. So, I mean, you could type in probiotics and any disease process, and you're going to have the study. Yeah. So it's certainly interesting. Yeah. What did this one find?
Yeah, this one. And the reason it caught my eye is because sarcopenia is like a real thing. And, so many so-called experts talking about healthy longevity, and they talk about muscle and protein. So I thought, wow, what if we did take a probiotic for muscle mass and, just frailty?
You'd have a lot of money if you had something that
I know, right? So this one was a study out of China, Italy, Sweden, Japan, all these countries, and about 733 older adults studied.
Okay.
And they studied them for muscle mass, sarcopenia. And we don't know the age group. We just know that they were elderly,
Okay. Should we explain sarcopenia?
Yes, I think sarcopenia. Yes.
Yeah, it's basically not having enough muscle. I think you could probably leave it at that. The skeletal muscle system has, not always been as respected as the heart or the brains and all of these other really important organs, but we're increasingly, I'd say the last 5 years, talking more about the skeletal muscle system and how it's critical for the well-being of all the other organs and healthy aging, not falling, hip fractures. I mean, it's critical. So it's a hot topic, sarcopenia.
Yeah. So, in fact, I had a friend come over the other day, and he said, well, he's in his 80s, and he says, I walk twice a day. And I said, are you doing any strength training? He said, no, I found that very boring. So I said, you know what? Sarcopenia is real. Yep. Let's find you a trainer. Let's get you started. So this, going back to the study, it was a meta-analysis of 7 RCTs, and it was about from 8 weeks to 6 months, the study. And they studied probiotics like plantarum, Lactobacillus reuteri, and some mixtures, multi-strains of probiotics. And that also included Bifidobacterium and Lactobacillus.
Okay.
And so there were 2 studies, and of course the control group was placebo. And
RCT is randomized controlled trial.
Correct.
This is the gold standard of evidence. So when we hear RCT, we perk our ears up.
Yeah, something you and I look at when we are defining bad medicine sometimes.
Yeah, well said. Yeah, if it's not an RCT.
So many. Yeah.
Yeah.
It's like, you're like, okay, how many people in the study? Yeah. So the 2 studies also prescribed resistance training and physical activity to these groups, these control groups. There was a large effect size on muscle mass increase and strength in the study group compared to the placebo. So that was very interesting, right? But
shocked.
But there was a lot of variation in the study. Okay. So that was like, I don't know, that's the whole thing about studies, right? Especially in meta-analysis, there was a variation in these studies. Right. But still, if this really had such a good increase in muscle mass, I'm wondering, if I should be even suggesting this to my clients in their 70s and 80s. What are your thoughts on that?
So I've learned to hold my skepticism for probiotic studies because I think that the microbiome is wondrous, mysterious, And, I'm humbled by what it can do.
Yeah.
So I'm generally open to this being real. I certainly see this entering my practice because I have patients who are working to build muscle because sarcopenia is so hot right now.
Yeah.
And they do complain that it's not working.
Yeah.
And buy a couple bottles of probiotics, 2 months, and let me know if your smart scale says, it's not perfect, but smart scale says you gained muscle mass, or do like a DEXA type thing and look. And we can just do we call it an N of one, one person study, before and after, and see if it works. So it sounds a little bit practice changing for me. I'd at least give it a shot. Yeah.
In my world, I call it an experimental goal, because if a client is on a supplement and without really seeing, is it beneficial? What's the point? We track it, we see what's happening, and not change anything else, but just add that supplement and see what happens in a month or 2 months. If there's a change, then that's a keeper for some time, and then add other things to the protocol.
The other thing that would come up with patients, this example patient who's difficulty adding muscle, they're really working at it. I said, try this. There's some studies, 7 studies. Is then what? Because are we now adding on a lifelong supplement that they'll have to buy, forever? Cost, of course, the supplements are going to change because companies get sold and formulations change. And what's the long-term looking like? Because my understanding, correct me if I'm wrong, these probiotics are generally ineffective at changing the microbiome long-term. They provide the short-term adjustment. And now there are ways to do the long-term, poop pills and fecal transplants, but these are not very appetizing, we'll say.
Yeah. And besides, with the probiotics, there's so many things that you need to, for the efficacy of the probiotic, there's so many things that you need to think about, and most people are just lured in by marketing. Oh, that looks like a nice shiny bottle, I'll buy it. But what is the strain? Is it just a microbe, or is it there to stay? How do we make it populate in your colon? What other things can you do to help, like food and, like supplemental food? That becomes more of a conversation, I think, than just a supplement.
That's the other really hard part that I would have with this conversation with a patient is they would say, okay, which one? And well, in a busy clinic, I'll say, I'll send you something, I'll get it to you. I'm not going to, because that's a mess. There's thousands with, as you say, different doses, colony forming units, quality things to factor in, refrigeration, different brands. Can you trust the brands? And so, people just throw their hands up and they say, this is bother with any of this. I can't even get a solid answer. I guess this is one advantage of having a supplement company as the sponsor of a study is that you have, if it's a big enough study, you actually know the one to do,
right?
For me. But here it sounds like they were all over the place. And so the patient's obviously going to want to take the best one. So I have 7 studies, all these different mixtures. I mean, it's a little bit messy.
So, if I'm looking at Bifidobacterium, Lactobacillus reuteri, and all of these other things, I would probably say, let's start with food. Maybe we increase certain foods and then maybe, and because across the board, like you said, they could be expensive. They could, is it, but again, we're looking at it as an experiment. So, But interesting study.
The other thing is you have all of the variation that we just talked about with the supplement itself, but then you have the variation in the host, in the person taking it, and you have the interaction. So a certain brand dose might work perfectly in person A and not at all in person B because the host's microbiome doesn't accept it or it doesn't gel well. I mean, I've had people get significant side effects from probiotics, presumably because it doesn't gel well. So, this is a bit of a blind, close your eyes, throw a dart, hope it at least gets on the board and, doesn't poke anyone's eye out. And that's
Yeah, and the dosage can never be what the bottle says. You have to really go slow with probiotics. I mean, it all depends on who's taking it. I mean, I had that experience with someone with acromansia, and it's all over the news. Everybody is talking about it and how it helps with weight loss, blood sugar, you name it. It seems like the magic pill, right? Hasn't been the case for all my clients. Some, it's fabulous. It really helps them with blood sugar balance. Others, it does just the opposite.
Pendulum. Yeah. I had the same thing happen to a patient. She's like kind of still not back to normal. Yeah, that's a little bit of a scary tale of, getting into these probiotics, which are promising. I mean, this is very promising. But as our conversation goes, I think we're both coming to the point of prebiotic foods or probiotic foods.
Yeah, probiotic and prebiotic.
Maybe this is more of a proof of concept, and then we focus more on diet and laying down the foundation for our own microbiome to shift toward a more healthy pattern.
Yeah, just the knowledge about your own microbes and the importance that diet can change things very drastically with your microbiome. I think that is a good starting point for anyone to know. I mean, because it's not like anything else where it takes months. Even a simple thing as your blood sugar takes 3 months to, to see certain changes, but with your microbiome, it's immediate. It starts responding to certain kinds of food, especially plant-based diversity. Things start changing very quickly because then your saccharolytic fermentation, your carbohydrate fermentation increases.
Big words.
Carbohydrates, simple words, carbohydrate fermentation. I see that in a lot of my clients. As soon as they start increasing these foods and I retest them, admitted, this is all not diagnostic. The tests right now, they're more just a functional. But I see a difference in the diversity, in the alpha diversity. The microbes that are helping them starts.
Well, maybe we should shift the discussion to what are very realistic ways to incorporate. Maybe we'll start with probiotic foods. I mean, I've given patients lists and told them here, 5 probiotic foods, but I think that might not be enough. At least it seems to me I'm not giving the best advice I can give. Just like with exercise, it's not enough to say oh, you got to do all these exercises. You have to tell them or work with them. How can you fit this in to your life? What food do you already cook and enjoy? Okay, that one you can add this probiotic, right? So do you have specific, I have a bottle of kimchi and Bubby's pickles in my fridge, which I honestly I don't even eat with meals usually. And that's kind of, I guess, just really simple. But cooking with probiotics and adding them to common dishes, do you have stuff that works?
But the thing is, again, it's very bio-individual. So I usually start with what the client wants. Like yesterday, I had a client who said, my LDL is so high. I've heard all these stories about different kinds of soluble fibers. What would your suggestion be? So it's coming from the client, which means that there's already a buy-in. I'm not giving her a list and say, you better do all of this if you want to see this result. That's never going to work. Because it's just a list. They're not paying attention to it.
Exactly.
But then I said, well, you seem to be very interested in fibers. Is there anything in particular that caught your eye? And she said, well, I saw on Reddit that psyllium husk is a game changer. I said, it's fantastic. Then I gave her information about psyllium husk. I gave her the options of you can take it as a powder, ground, or as a pill, how to take it, when to take it, and let's try this as a 2-week experiment. See what happens.
You see where they're at first.
Yeah.
You're already thinking about this. Perfect. Okay. That's always good way to people.
But let's say they come in and they're saying that and they have SIBO, for example. I know that it's too much of a FODMAP food. I would say, what about guar gum? And I'd give them an option. And I would say, studies suggest that this is easier on someone with SIBO. So, and then I send them information, says, read up on it, and then we'll talk about it next week. And then if they're okay with it, then we start with that
blowing my mind. I definitely have never recommended guar gum, so I'm captive audience here. I have to hear more. I know it's like a food additive. It's pretty safe. That's kind of where my knowledge.
It's safe, and there are other things like mastic gum and things like that. But I have seen there are certain brands that are specifically for SIBO clients, because they're already on a low FODMAP diet, and psyllium husk just doesn't do it for them. So guar gum is another.
So how do you ingest it?
I start very slow.
Like, is it a powder? What are we talking?
It's a powder, and they add it into their smoothie, or they take it the last thing at night. And you will know pretty soon if it's working,
How do you know?
Well, because,
diarrhea or something?
It's SIBO diarrhea, SIBO constipation, and if their bowel movements become a little bit more stable, then they are, I think this is working.
It's something. Yeah.
Yeah, and sometimes it's a placebo thing. I'm never sure 100%, but if the client is feeling happy with it and they're getting some benefit.
Better the placebo be safe than the placebo have potential side effects. Someone wise, I'm sure.
And I think that's where our responsibility is, to kind of guide and empower them with education, and then they make the choice.
You ever come across patients, clients? It's a small number, but they just want to be told what to do. So they're not giving you much. How do you address that?
All the time, say, gosh, I know I don't have the time for this. You just tell me what to do. I'll do it. I just have to tell them my experience. It doesn't work. It's not going to be a habit. You're going to do what I ask you to do. And then you're not always going to have me in your life. And then when this relationship is done, you're just going to just say, what the heck? What did I learn? What am I supposed to do now? That kind of hand-holding is not very,
Yeah. So from the beginning, you're fostering independence, really.
Autonomy. They just make the decision. Saying, what do you think? What would you like in your life? So I'm preparing them for the day when they don't have me in their life, from day one. So because that's what I want for them. I want them to be independent, learn how to manage their weight or their LDL or whatever, So, yeah.
We did it. We did a thing.
Yeah.
All right. Cool. Well, we love our listeners. Let us know what you want to hear. And we will be doing reels, shorts. Like, subscribe.